Colon cancer is the third most common cancer worldwide, affecting millions of people each year. Despite its prevalence, the disease often goes unnoticed until it has progressed to advanced stages. This is because the early signs of colon cancer can be so subtle that they're mistaken for everyday issues like indigestion or minor bowel irregularities. The result? Many people delay seeking medical attention, which drastically reduces their chances of survival. However, there's good news. Early detection can improve survival rates by up to 90%. Recognizing the warning signs early is one of the most powerful tools we have in the fight against this disease.
The danger of silent symptoms. So what do we mean by silent symptoms? These are the signs that sneak under the radar, symptoms that don't cause immediate alarm but may indicate something serious happening in your body. Unlike acute illnesses, where symptoms like high fever or severe pain demand attention, colon cancer can progress quietly. A change in bowel habits, a bit of fatigue, or a mild abdominal cramp might not seem significant on their own. Yet, these could be the body's way of signaling something more serious. Colon cancer typically begins as small, non-cancerous growths, called polyps, in the colon or rectum. Over time, some polyps may turn into cancer. Early in this process, the symptoms are mild, almost imperceptible. It's this quiet progression that makes colon cancer particularly dangerous, especially for individuals under 60 who might not associate these subtle symptoms with a potentially life-threatening disease. That's why this video is so important. Today, we'll walk you through 12 silent symptoms of colon cancer that you need to be aware of. Each of these signs is backed by scientific research, so you can trust the information provided. By understanding these warning signs, you'll be better equipped to take action, whether it's visiting your doctor, seeking a second opinion, or simply staying vigilant about your health. What is colon cancer? Colon cancer begins in the large intestine, colon, or rectum, often developing from small, non-cancerous growths known as polyps. These polyps form on the inner lining of the colon and can remain harmless for years. However, certain types of polyps, like adenomatous polyps, have the potential to become cancerous. The transformation from a benign polyp to colon cancer is typically slow, sometimes taking up to a decade. This gradual progression is why early screening can be so effective. It provides a chance to detect and remove polyps before they become dangerous. Colon cancer progresses in stages, starting with localized growth in the inner lining, stage 0, and advancing to more invasive stages, where cancer spreads to nearby tissues, stage 2, lymph nodes, stage 3, and distant organs like the liver or lungs, stage 4. Recognizing this progression underscores the importance of catching the disease in its early, more treatable stages. Who is at risk? Although colon cancer is often associated with older adults, it is increasingly affecting younger individuals under 60. Risk factors can be divided into two categories: those we can control and those we cannot. Uncontrollable factors include family history and genetics. If you have close relatives with colon cancer or genetic conditions like Lynch syndrome or familial adenomatous polyposis, FAP, your risk significantly increases. Chronic inflammatory conditions such as Crohn's disease and ulcerative colitis also elevate the likelihood of developing colon cancer. Controllable factors play a large role as well. Diets high in red or processed meats and low in fiber, fruits, and vegetables are associated with higher risk. A sedentary lifestyle, smoking, and excessive alcohol consumption further contribute to the likelihood of developing colon cancer. Obesity is another major factor, as it has been linked to inflammation and hormonal changes that may promote cancer development. Why symptoms can be overlooked. Colon cancer is often referred to as a silent disease because its symptoms overlap with common, less serious conditions. Many people dismiss changes in bowel habits as symptoms of irritable bowel syndrome, IBS, or hemorrhoids. Fatigue is often attributed to busy lifestyles, while abdominal discomfort is mistaken for minor digestive issues. This overlap creates a dangerous delay in seeking medical attention, allowing the disease to progress undetected. Understanding these risks and the subtleties of early symptoms is essential. By staying informed and proactive, you can break through the silence surrounding colon cancer and take steps toward timely detection and prevention. The 12 silent symptoms. Number 1. Persistent changes in bowel habits. A sudden and lasting change in bowel habits, such as alternating between diarrhea and constipation, can be an early warning sign of colon cancer. This occurs when a tumor disrupts the normal function of the colon, leading to inconsistent stool patterns. For example, research has shown that partial blockages caused by growths in the colon can affect how stool passes through the digestive system. If you notice these changes persisting for more than a few weeks, it's important to consult a healthcare professional to rule out serious conditions like colorectal cancer. 2. Unexplained fatigue. Fatigue that doesn't improve with rest is another silent symptom. Colon cancer can cause slow internal bleeding, leading to iron deficiency anemia. Without enough iron, your body struggles to produce hemoglobin, which carries oxygen to tissues, resulting in persistent tiredness. Many people attribute fatigue to stress or a busy lifestyle, but when it's accompanied by other symptoms like pale skin or shortness of breath, it may signal something more serious. Blood tests can confirm anemia, which may warrant further investigation for underlying causes like colon cancer. 3. Blood in stool or rectal bleeding. One of the most alarming signs of colon cancer is blood in the stool. Bright red blood typically indicates bleeding from the rectum or lower colon, while dark or tar-like stool suggests bleeding from higher up in the digestive tract. Research shows that gastrointestinal bleeding is a common symptom in patients with colorectal cancer. 4. Abdominal pain or cramps. Persistent abdominal pain or cramping may indicate a tumor obstructing or pressing against the intestines. This discomfort often occurs in the lower abdomen and can vary from mild to severe. Tumors may create partial blockages, causing sharp, cramp-like pains as the digestive system tries to move contents past the obstruction. 5. Unintended weight loss. Losing weight without making dietary or lifestyle changes can be a concerning sign. Colon cancer can alter metabolism, making it harder for the body to absorb nutrients. Additionally, tumors can suppress appetite and increase energy demands, leading to weight loss. A study on cancer patients found that unexplained weight loss is a frequent early indicator of malignancy. If this occurs alongside other symptoms, it's crucial to explore the possibility of colon cancer. 6. Feeling of incomplete bowel movements. Many patients with colon cancer report a sensation that their bowel movements are incomplete, even after using the restroom. This feeling arises when a tumor in the rectum or lower colon creates a partial blockage, preventing full evacuation. The sensation can be frustrating and may lead individuals to strain unnecessarily. While other conditions like constipation or IBS can cause similar symptoms, a persistent feeling of incomplete evacuation warrants further evaluation. 7. Narrow or ribbon-like stool. A change in the shape of stool, such as becoming thinner or ribbon-like, can indicate a partial blockage in the colon caused by a tumor. As the growth narrows the passageway, stool takes on a compressed shape. While occasional changes in stool size can result from dietary factors, a consistent pattern of narrow stools should raise concern. Medical imaging or a colonoscopy may be necessary to investigate the cause. 8. Frequent gas, bloating, or fullness. Gas, bloating, or a constant feeling of fullness could be linked to colon cancer if they occur regularly without clear dietary causes. These symptoms often result from blockages or slowed movement in the colon due to tumors. Gas buildup can also cause discomfort and visible abdominal distension. While many gastrointestinal issues cause bloating, persistent episodes that don't respond to dietary changes should not be ignored. 9. Persistent nausea or vomiting. Colon cancer may cause nausea or vomiting, particularly in advanced cases where tumors block the intestinal tract. When food cannot pass through the digestive system properly, it can lead to discomfort and regurgitation. Persistent nausea, especially when paired with other symptoms like abdominal pain or bloating, should prompt further investigation to identify its cause. 10. Iron deficiency anemia. Iron deficiency anemia often develops in colon cancer patients due to slow, chronic blood loss in the gastrointestinal tract. Symptoms of anemia include fatigue, weakness, pale skin, and dizziness. A study found that iron deficiency anemia is one of the most common reasons colon cancer is initially detected in patients. A simple blood test can confirm anemia, and additional tests may be needed to uncover its root cause. 11. Unexplained back pain. Although less commonly associated with colon cancer, unexplained back pain can occur when a tumor in the abdomen presses on nerves or surrounding tissues. This pain often radiates and may feel like a dull ache or sharp discomfort. 12. Dark stool or tar-like appearance. Dark or tar-like stools may indicate bleeding higher up in the digestive tract, a potential sign of colon cancer. As blood travels through the intestines, it is digested and changes color, resulting in black or tar-like stool. This symptom is often overlooked or attributed to dietary factors, but persistent dark stools should always be investigated. A stool test or colonoscopy can help determine the cause and confirm whether colon cancer is involved. Understanding these subtle symptoms and taking action when they arise can make a life-saving difference. If you experience any of these signs persistently, consult a healthcare professional for timely evaluation and intervention. Diagnosing colon cancer. Screening tests. Diagnosing colon cancer early can significantly improve outcomes, making screening an essential tool in prevention. The most common and effective screening method is a colonoscopy, during which a doctor examines the colon using a flexible tube with a camera. This test not only identifies abnormalities, but also allows for the removal of precancerous polyps on the spot. Another non-invasive option is the stool DNA test, which detects genetic markers and traces of blood in stool associated with colon cancer. For those unable to undergo a colonoscopy, a CT colonography, or virtual colonoscopy provides a detailed image of the colon using X-rays. Experts recommend that most individuals begin screening at age 45. However, those with a family history of colon cancer or genetic conditions should start earlier, often by age 40 or even earlier, based on their doctor's advice. The frequency of screenings depends on the method used and the patient's risk factors, with colonoscopies typically repeated every 10 years for average-risk individuals. When to see a doctor? It's crucial to seek medical attention if you experience multiple symptoms of colon cancer or if any single symptom persists for more than a few weeks. Symptoms like blood in the stool, unexplained weight loss, or persistent abdominal pain should never be ignored. Even if these symptoms turn out to have a benign cause, identifying the underlying issue is key to overall health. Scientific advances. In recent years, advancements in medical technology have improved the accuracy and accessibility of colon cancer detection. Liquid biopsy tests, which analyze blood samples for cancer DNA, show promise for early diagnosis. Similarly, research into biomarkers, specific proteins, or genetic material linked to cancer may lead to less invasive and more precise tests. These innovations aim to reduce the discomfort and fear associated with traditional screenings, encouraging more people to take proactive steps toward early detection. Preventive measures. Dietary changes. A healthy diet plays a critical role in reducing the risk of colon cancer. Incorporating fiber-rich foods like whole grains, fruits, and vegetables into your meals supports regular bowel movements and helps remove waste products more efficiently. Avoiding red and processed meats, which are linked to higher cancer risk, can also make a significant difference. Studies suggest that replacing these with lean proteins like fish or plant-based options may further lower risk. Physical activity. Regular physical activity not only improves overall health, but also reduces the likelihood of developing colon cancer. Exercise helps regulate body weight, decreases inflammation, and promotes a healthy digestive system. Aim for at least 30 minutes of moderate exercise, like brisk walking or cycling, most days of the week. Lifestyle choices. Quitting smoking and reducing alcohol intake are critical steps toward cancer prevention. Smoking introduces harmful toxins into the body, while excessive alcohol consumption increases the risk of colorectal tumors. By eliminating or reducing these habits, you can significantly improve your long-term health. Regular screenings. Finally, routine screenings are one of the most effective preventive measures against colon cancer. By detecting and removing polyps before they become cancerous, screenings save lives. Don't wait for symptoms to appear. Follow your doctor's recommendations based on your age and risk factors. Early action can prevent complications and lead to better outcomes. By making these lifestyle changes and staying proactive about your health, you can take significant steps toward reducing your risk of colon cancer. Prevention starts with the choices you make today. Colon cancer often begins with subtle, silent symptoms that can be easy to overlook. Let's briefly revisit the 12 signs we've discussed: persistent changes in bowel habits, unexplained fatigue, blood in stool or rectal bleeding, abdominal pain or cramps, unintended weight loss, the feeling of incomplete bowel movements, narrow or ribbon-like stools, frequent gas or bloating, persistent nausea or vomiting, iron deficiency anemia, unexplained back pain, and dark or tar-like stools. Recognizing these symptoms early and understanding their potential significance is the first step in protecting your health. It's natural to feel concerned or even fearful when discussing cancer, but knowledge is a powerful ally. While the idea of colon cancer can be daunting, it's important to remember that early detection and prompt action save lives. Advances in medicine, effective screening tools, and better awareness mean that colon cancer is not only treatable, but often preventable. You are not alone in this journey. Your healthcare provider is there to guide you, and resources are available to support you every step of the way. Now that you're informed, it's time to act. If you've noticed any of the symptoms we've covered, or if you fall into a higher risk category, don't hesitate to consult a doctor. Regular screenings are crucial, even if you feel perfectly healthy. Share this information with loved ones. It could save someone's life. Colon cancer awareness starts with conversations like these, and by spreading knowledge, you're contributing to the fight against this disease. If you found this video helpful, consider subscribing to our channel for more health-related content. We're committed to bringing you accurate, science-based information to empower your health choices. Don't forget to like and share this video so others can benefit from it too. Remember, your body is always communicating with you. It's up to you to listen. Even small changes can signal something important. Take charge of your health today, because listening to your body might just save your life. Thank you for watching, and take care of yourself and your loved ones.